Public health, the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private, communities and individuals. Analyzing the determinants of health of a population and the threats it faces is the basis for public health. The public can be as small as a handful of people or as large as a village or an entire city. In the case of a pandemic, it may encompass several continents. The concept of health takes into account physical, psychological, and social well-being, among other factors. Public health is an interdisciplinary field. For example, epidemiology, biostatistics, social sciences, and management of health services are all relevant. Other important subfields include environmental health, community health, behavioral health, health economics, public policy, mental health, health education, health politics, occupational safety, disability, oral health, gender issues in health, and sexual and reproductive health. Public health, together with primary care, secondary care, and tertiary care, is part of a country's overall healthcare system. Public health is implemented through the surveillance of cases and health indicators, and through the promotion of healthy behaviors. Common public health initiatives include promotion of hand washing and breastfeeding, delivery of vaccinations, promoting ventilation and improved air quality both indoors and outdoors, suicide prevention, smoking cessation, obesity education, increasing healthcare accessibility and distribution of condoms to control the spread of sexually transmitted diseases. There is a significant disparity in access to healthcare and public health initiatives between developed countries and developing countries, as well as within developing countries. In developing countries, public health infrastructures are still forming. There may not be enough trained healthcare workers, monetary resources, or, in some cases, sufficient knowledge to provide even a basic level of medical care and disease prevention. A major public health concern in developing countries is poor maternal and child health, exacerbated by malnutrition and poverty and limited implementation of comprehensive public health policies. Developed nations are at greater risk of certain public health crises, including childhood obesity, although overweight populations in low and middle-income countries are catching up. From the beginnings of human civilization, communities promoted health and fought disease at the population level. In complex, pre-industrialized societies, interventions designed to reduce health risks could be the initiative of different stakeholders, such as army generals, the clergy, or rulers. Great Britain became a leader in the development of public health initiatives, beginning in the 19th century, due to the fact that it was the first modern urban nation worldwide. The public health initiatives that began to emerge initially focused on sanitation, for example, the Liverpool and London sewerage systems, control of infectious diseases, including vaccination and quarantine, and an evolving infrastructure of various sciences, e.g. statistics, microbiology, epidemiology, sciences of engineering. Public health has been defined as the science and art of preventing disease, prolonging life, and improving quality of life through organized efforts and informed choices of society, organizations, public and private, communities and individuals. The public can be as small as a handful of people or as large as a village or an entire city. The concept of health takes into account physical, psychological, and social well-being. As such, according to the World Health Organization, health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Public health is related to global health, which is the health of populations in the worldwide context. It has been defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. International health is a field of healthcare, usually with a public health emphasis, dealing with health across regional or national boundaries. Public health is not the same as public health care, publicly funded health care. The term preventive medicine is related to public health. The American Board of Preventive Medicine separates three categories of preventive medicine: aerospace health, occupational health, and public health and general preventative medicine. Jung, Boris, and Lushniak argue that preventive medicine should be considered the medical specialty for public health, but note that the American College of Preventive Medicine and American Board of Preventive Medicine do not prominently use the term public health. Preventive medicine specialists are trained as clinicians and address complex health needs of a population, such as by assessing the need for disease prevention programs, using the best methods to implement them, and assessing their effectiveness. Since the 1990s, many scholars in public health have been using the term population health. There are no medical specialties directly related to population health. Vallis argues that consideration of health equity is a fundamental part of population health. Scholars such as Kagan and Pielka express concerns about bringing general issues of wealth distribution into population health. Pielka worries about stealth issue advocacy in population health. Jung, Boris, and Lushniak consider population health to be a concept that is the goal of an activity called public health practiced through the specialty preventive medicine. Lifestyle medicine uses individual lifestyle modification to prevent or revert disease and can be considered a component of preventive medicine and public health. It is implemented as part of primary care rather than a specialty in its own right. Vallis argues that the term social medicine has a narrower and more biomedical focus than the term population health. Purpose. The purpose of a public health intervention is to prevent and mitigate diseases, injuries, and other health conditions. The overall goal is to improve the health of individuals and populations, and to increase life expectancy. Components. Public health is a complex term, composed of many elements and different practices. It is a multifaceted, interdisciplinary field. For example, epidemiology, biostatistics, social sciences, and management of health services are all relevant. Other important subfields include environmental health, community health, behavioral health, health economics, public policy, mental health, health education, health politics, occupational safety, disability, gender issues in health, and sexual and reproductive health. Modern public health practice requires multidisciplinary teams of public health workers and professionals. Teams might include epidemiologists, biostatisticians, physician assistants, public health nurses, midwives, medical microbiologists, pharmacists, economists, sociologists, geneticists, data managers, environmental health officers, public health inspectors, bioethicists, gender experts, sexual and reproductive health specialists, physicians, and veterinarians. The elements and priorities of public health have evolved over time, and are continuing to evolve. Common public health initiatives include promotion of hand washing and breastfeeding, delivery of vaccinations, suicide prevention, smoking cessation, obesity education, increasing healthcare accessibility and distribution of condoms to control the spread of sexually transmitted diseases. Methods. Public health aims are achieved through surveillance of cases and the promotion of healthy behaviors, communities, and environments. Analyzing the determinants of health of a population and the threats it faces is the basis for public health. Many diseases are preventable through simple, non-medical methods. For example, research has shown that the simple act of hand washing with soap can prevent the spread of many contagious diseases. In other cases, treating a disease or controlling a pathogen can be vital to preventing its spread to others, either during an outbreak of infectious disease or through contamination of food or water supplies. Public health, together with primary care, secondary care, and tertiary care, is part of a country's overall healthcare system. Many interventions of public health interest are delivered outside of health facilities, such as food safety surveillance, distribution of condoms and needle exchange programs for the prevention of transmissible diseases. Public health requires geographic information systems, GIS, because risk, vulnerability, and exposure involve geographic aspects. Ethics. A dilemma in public health ethics is dealing with the conflict between individual rights and maximizing right to health. Public health is justified by consequentialist utilitarian ideas, but is constrained and critiqued by liberal, deontological, principlist, and libertarian philosophies. Stephen Holland argues that it can be easy to find a particular framework to justify any viewpoint on public health issues, but that the correct approach is to find a framework that best describes a situation and see what it implies about public health policy. The definition of health is vague and there are many conceptualizations. Public health practitioners' definition of health can differ markedly from members of the public or clinicians. This can mean that members of the public view the values behind public health interventions as alien, which can cause resentment amongst the public towards certain interventions. Such vagueness can be a problem for health promotion. Critics have argued that public health tends to place more focus on individual factors associated with health at the expense of factors operating at the population level. Historically, public health campaigns have been criticized as a form of healthism, as moralistic in nature rather than being focused on health. Medical doctors, Petra Schrabanek and James McCormick wrote a series of publications on this topic in the late 1980s and early 1990s criticizing the UK's The Health of the Nation campaign. These publications exposed abuse of epidemiology and statistics by the public health movement to support lifestyle interventions and screening programs. A combination of inculcating a fear of ill health and a strong notion of individual responsibility has been criticized as a form of health fascism by a number of scholars, objectifying the individual with no considerations of emotional or social factors. The World Health Organization, WHO, is a specialized agency of the United Nations responsible for international public health. The WHO Constitution, which establishes the agency's governing structure and principles, states its main objective as the attainment by all peoples of the highest possible level of health. The WHO's broad mandate includes advocating for universal health care, monitoring public health risks, coordinating responses to health emergencies, and promoting human health and well-being. The WHO has played a leading role in several public health achievements, most notably the eradication of smallpox, the near eradication of polio, and the development of an Ebola vaccine. Its current priorities include communicable diseases, particularly HIV/AIDS, Ebola, COVID-19, malaria and tuberculosis, non-communicable diseases such as heart disease and cancer, healthy diet, nutrition and food security, occupational health, and substance abuse. Most governments recognize the importance of public health programs in reducing the incidence of disease, disability, and the effects of aging and other physical and mental health conditions. However, public health generally receives significantly less government funding compared with medicine. Although the collaboration of local health and government agencies is considered best practice to improve public health, the pieces of evidence available to support this is limited. Public health programs providing vaccinations have made major progress in promoting health, including substantially reducing the occurrence of cholera and polio and eradicating smallpox, diseases that have plagued humanity for thousands of years. The World Health Organization, WHO, identifies core functions of public health programs including providing leadership on matters critical to health and engaging in partnerships where joint action is needed, shaping a research agenda and stimulating the generation, translation, and dissemination of valuable knowledge, setting a norms and standards and promoting and monitoring their implementation, articulating ethical and evidence-based policy options, monitoring the health situation and assessing health trends. In particular, public health surveillance programs can serve as an early warning system for impending public health emergencies, document the impact of an intervention, or track progress towards specified goals, and monitor and clarify the epidemiology of health problems, allow priorities to be set, and inform health policy and strategies. Diagnose, investigate, and monitor health problems and health hazards of the community. Education and training of public health professionals is available throughout the world in schools of public health, medical schools, veterinary schools, schools of nursing, and schools of public affairs. The training typically requires a university degree with a focus on core disciplines of biostatistics, epidemiology, health services administration, health policy, health education, behavioral science, gender issues, sexual and reproductive health, public health nutrition, and occupational and environmental health. In the global context, the field of public health education has evolved enormously in recent decades, supported by institutions such as the World Health Organization and the World Bank, among others. Operational structures are formulated by strategic principles, with educational and career pathways guided by competency frameworks, all requiring modulation according to local, national, and global realities. Moreover, integrating technology or digital platforms to connect to low health literacy LHL groups could be a way to increase health literacy. It is critically important for the health of populations that nations assess their public health human resource needs and develop their ability to deliver this capacity, and not depend on other countries to supply it. In the United States, the Welch-Rose Report of 1915 has been viewed as the basis for the critical movement in the history of the institutional schism between public health and medicine because it led to the establishment of schools of public health supported by the Rockefeller Foundation. The report was authored by William Welch, founding dean of the Johns Hopkins Bloomberg School of Public Health, and Wycliffe Rose of the Rockefeller Foundation. The report focused more on research than practical education. Some have blamed the Rockefeller Foundation's 1916 decision to support the establishment of schools of public health for creating the schism between public health and medicine and legitimizing the rift between medicine's laboratory investigation of the mechanisms of disease and public health's non-clinical concern with environmental and social influences on health and wellness. Even though schools of public health had already been established in Canada, Europe, and North Africa, the United States had still maintained the traditional system of housing faculties of public health within their medical institutions. A $25,000 donation from businessman Samuel Zemurray instituted the School of Public Health and Tropical Medicine at Tulane University in 1912, conferring its first Doctor of Public Health degree in 1914. The Yale School of Public Health was founded by Charles Edward Amory Winslow in 1915. The Johns Hopkins School of Hygiene and Public Health was founded in 1916 and became an independent, degree-granting institution for research and training in public health, and the largest public health training facility in the United States. By 1922, schools of public health were established at Columbia and Harvard on the Hopkins model. By 1999 there were 29 schools of public health in the U.S., enrolling around 15,000 students. Over the years, the types of students and training provided have also changed. In the beginning, students who enrolled in public health schools typically had already obtained a medical degree. Public health school training was largely a second degree for medical professionals. However, in 1978, 69% of American students enrolled in public health schools had only a bachelor's degree. Schools of public health offer a variety of degrees, generally fall into two categories, professional or academic. The two major postgraduate degrees are the Master of Public Health, MPH, or the Master of Science in Public Health, MSPH. Doctoral studies in this field include Doctor of Public Health, DRPH, and Doctor of Philosophy, PhD, in a subspecialty of greater public health disciplines. DRPH is regarded as a professional degree and PhD as more of an academic degree. Professional degrees are oriented towards practice in public health settings. The Master of Public Health, Doctor of Public Health, Doctor of Health Science, DHSC/DHS, and the Master of Healthcare Administration are examples of degrees which are geared towards people who want careers as practitioners of public health in health departments, managed care and community-based organizations, hospitals and consulting firms, among others. Master of Public Health degrees broadly fall into two categories: those that put more emphasis on an understanding of epidemiology and statistics as the scientific basis of public health practice, and those that include a more wide range of methodologies. A Master of Science of Public Health is similar to an MPH but is considered an academic degree, as opposed to a professional degree, and places more emphasis on scientific methods and research. The same distinction can be made between the DRPH and the DHSC. The DRPH is considered a professional degree and the DHSC is an academic degree. Academic degrees are more oriented towards those with interests in the scientific basis of public health and preventive medicine who wish to pursue careers in research, university teaching in graduate programs, policy analysis and development, and other high-level public health positions. Examples of academic degrees are the Master of Science, Doctor of Philosophy, Doctor of Science, SCD, and Doctor of Health Science, DHSC. The doctoral programs are distinct from the MPH and other professional programs by the addition of advanced coursework and the nature and scope of a dissertation research project. Thank you for watching this video.